Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 757,022 confirmed cases of COVID-19 in Canada and 258,700 cases in Ontario. Chatham-Kent has 1,121 cases, and Sarnia-Lambton has reported 1,788 cases. Michigan now has 552,556 cases, with 28,352 cases being in Detroit. Today we are reporting 55 new cases of COVID-19 in Windsor and Essex County. 9 are close contacts of confirmed cases, 12 cases are related to outbreaks, 3 are community acquired, and 31 cases are still being investigated. We have had 11,915 cases since March. 10,679 cases are now resolved, and 939 people are active cases at this time. 92 confirmed cases are currently in the hospital, and 12 people are in ICU. I'm sorry to be reporting an additional 8 deaths today. 6 people from long-term care and retirement homes. 4 men and 1 woman in their 80s, a woman in her 90s, and 2 people are from the community, a man in his 60s and a man in his 70s. Our community has now lost 303 people to COVID. 204 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 51 active outbreaks in Windsor and Essex County. 27 are in workplaces, 19 are in long-term care and retirement homes, and there are 5 outbreaks in our hospitals. Second round of vaccinations for residents, staff, and essential caregivers of long-term care homes will begin later this week. Despite the rollout of vaccine, please continue to follow public health measures. Stay home if you're sick, limit your close contacts to your household members only, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze, and download the COVID exposure app at canada.ca. If you have any symptoms of COVID-19, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. Common symptoms can include fever, new or worsening cough, barking cough, and chills. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us. I have not much to add today other than the sad deaths of 8 additional people in our community. As we continue to see the case counts going down, we are obviously are concerned about the number of people who are dying, and we have reported previously that death is a lagging indicator. So whatever we are seeing is a result of the cases that we have seen at least 2 to 3 weeks before. So it's unfortunate that we still have these deaths in the community, but with our most vulnerable residents of long-term care home and retirement home protected, we'll hope to see that that number will go down. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Nothing today, thank you.
Okay, any questions from the Windsor Star?
Yes, good morning. Just a quick question about the investigation into the death of the person who died sometime after receiving the COVID vaccine. When the investigation is complete, will the health unit make that information available to the media, or will we have to keep asking you for it?
No, you don't have to keep asking for it. I'll share whatever I can share once I get all the results. Obviously, because this is an active investigation and the coroner's office is involved in the investigation part. So all of that work is happening. We obviously want to make sure that there is a circle back and we report back to the community what the findings are, whether it's all linked to the vaccine or what happened and what can be done as an action item to prevent something from happening in the future.
Okay, thank you.
Any questions from AM 800?
I'm good right now, thank you.
Any questions from CTV?
Yes, good morning. If the cases continue to trend downward, do you think it will be safe for kids to return to school after February 10th?
Well, I think that's what we are hoping, that once we start to see a decline in the cases, the province is already moving forward with opening some of the schools in the region that are doing relatively well. So we anticipate that once our case counts come to a situation where the province feels comfortable, we feel comfortable that it's a good place to be. We want children to get the best education. This is their learning opportunity. We want the best for them. We want to make sure that they are getting the right education in the safe environment. So we'll definitely be looking at it once we get closer to the timeline.
Okay, thank you.
Any questions from CBC?
Thank you and good morning. Dr. Ahmed, are you optimistic that we'll be lifted out of the gray zone if the current trend continues? And I also wanted to ask, how would that work? Like, would we go to red or?
Good question. So I think even right now where our numbers stand, we are seeing a decline, a regular decline and steady decline. But our numbers are still pretty high. So even now when we are talking about, let's say, if we are getting 50 cases on an average every day, that means 350 cases a week. And then if we divide it by the size of the population, that would be still closer to 75 to 80 cases per 100,000 population. So we'll have to see where the numbers stand. And then based on that number, which restriction zone that we would be in. My guess is if we are trending downwards in the similar manner, we'll have to go back in the similar manner as well. So right now, if we are in gray lockdown, and if the numbers justify that we should be in red, we'll go to red. And if the numbers drop down significantly, then that's a good problem to have. But I think we'll still like to see that we're not rushing into it too quickly. It takes a lot. It takes a lot of energy. It takes a lot of effort from everyone, including our business community, when we are in lockdown, to bring the case counts down. And we definitely don't want to be in a situation where we open up too quickly, only to go into a lockdown again. So I think it's just the fine balance that we want to make sure that we do it right, not only for ourselves, but for everyone, including our local businesses and everyone is experiencing the consequences of all these closures and all these lockdown. But we'll like to continue to see the trend, and I think it's a good thing that our community is really progressing through. And we hope that in the next couple of weeks we will be in a better position to start talking about easing off some of these restrictions.
Thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
AM 800?
Dr. Ahmed, just going back to Melanie's question about the schools. So just say the province announces schools in our area can reopen. Would you have to lift the order, or has your order technically expired already?
So my order is already expired. So there is no order in place right now. It's the provincial restriction that's preventing from these schools to open up. So yeah, there's nothing in place from the health unit at this time.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
Sorry, it's on me. Thank you.
Any questions from CBC?
Thank you. Sorry,
Okay.
I answered for CTV.
Nope, no problem. Thank you, everyone.
Thanks.